Mehmet, Palliative Care Fellow, covers the patients in the Palliative Care Unit, or PCU. During the morning meeting, the interdisciplinary team, including doctors, nurses, social worker, physiotherapists, and the pharmacist, met to discuss all the PCU patients. The team talked about the case of a middle-aged man with advanced pancreatic cancer who was admitted for end-of-life care. The nurse alerted the fellow that the patient became very agitated and restless the night before. The fellow went to assess the patient after the meeting. He performed a quick assessment as he found the patient sleeping after receiving multiple doses of opioids and sedating antipsychotic Nozanan to manage the agitation and restlessness. The fellow told the nurse that the patient suffered from terminal delirium due to disease progression and opioids. The fellow told the nurse to use sedatives and antipsychotic for agitation if the symptoms recurred. But soon, the patient woke up and he was very agitated again. The nurse approached the fellow again and asked if he might want to reassess and investigate further the cause of the agitation as the patient's condition changed suddenly. The fellow became frustrated and defensive as he perceived the nurse as questioning his previous assessment and clinical competency. The nurse explained that she wasn't questioning the fellow's assessment, but she was concerned that there might be other underlying reasons for the agitation. The nurse went back to the patient, performed a bladder scan, and found the urinary bladder distended. She went back to the fellow and asked for the order to insert a urinary catheter. The fellow felt uncomfortable with the nurse's request and told the nurse that the patient did not want a catheter in the past and that the bladder scan may be inaccurate due to the patient recurrent ascites. The nurse spoke with the patient's substitute decision-maker, who agreed to the catheter insertion. The nurse approached the attending staff, and they ordered the indwelling urinary catheter insertion. Once inserted, the catheter drained around a liter of urine, suggesting underlying urinary retention. The patient agitation resolved after the management of the urinary retention. The patient did not require additional sedatives and died the next day peacefully. What causes the conflict between Mehmet and the nurse? In this module, we will look closer at working in a team-based environment.